Why don't you go ahead and pull up that welcome slide?
Wait a second.
You can either?
Yeah.
You know what? I'll share my screen. Can everyone see my screen okay?
Yes.
Okay, so why don't I do this? Sorry, everyone. Okay, so I think we're good to go. Hello, everyone. Welcome. My name is Amy Sam. I am the Health Education Project Specialist here at the Maxwell and Eleanor Blum Patient Family Learning Center.
And my name is Mariam Zaib, and I'm a health educator here at the Blum Center.
So before we begin, just kind of want to go over a few items. Please be aware that today's session is being recorded for educational purposes. If you're interested in viewing today's recording, it'll be made available later on this week on our Blum Center website. You can find us at massgeneral.org/Blum-Center. Please note you are in listen-only mode. Everyone has been muted so that we can reduce any feedback noise so that we can hear our guest speaker today. If you have any questions, please use the chat feature located at the bottom of your screen. We'll have time for questions and answers at the end of today's session. Only Blum Center staff and the guest speaker will see your questions. Please do not share any personal medical information or questions in the chat box. If you have any medical questions, please ask your doctor. All right, so let me close out that. And next, I would like to introduce everyone to Jennifer Blewett. She is a licensed clinical social worker and the clinical care coordinator at the West End Clinic at an outpatient, West End Clinic is an outpatient clinic specializing in addiction psychiatry at Massachusetts General Hospital. She joins us today to present on maintaining emotional wellness through telemental health and community support while social distancing during COVID-19. So please join me in welcoming Jennifer.
Thanks, everyone. I'm just going to go ahead and share my screen so we can get started here. Just going to pop that up like that. All right. So thank you so much for having me today. Thanks so much for everyone joining us during your lunchtime hour. Like they said, my name is Dr. Jennifer Blewett. I'm a clinical social worker here at the Mass General Hospital, where I've been employed for the past 7 years. And I'm really excited to be able to spend a little bit of time with you today to talk about maintaining emotional wellness through telemental health while utilizing community supports during this very wild COVID-19 2020 year that we're experiencing at this time. So let me get started here. So, okay, let's get started. And first and foremost, I just want to tell you I have no disclosures to state today. I'm a current Massachusetts General employee since 2013 as a clinical social worker, but I am not an active researcher. I have nothing that I need to disclose today. I'm not engaged in any way with any sort of health insurance companies or whatsoever. So just wanted to get that off of and out of the way first. And objectives. So I'm really glad that you are all joining me today. I think talking about emotional health right now during 2020 is something that's really, really important. So we're going to talk a little bit about, and I'm going to review how this novel COVID-19 coronavirus pandemic has disrupted the direct delivery of mental and emotional health care in the United States. And we'll talk a little bit more regionally as well when it comes to how it's being disrupted in the Eastern Massachusetts area where Massachusetts General Hospital is located. Then I want to have everyone try to understand why there's such an increased need for mental and behavioral health care services at this time for our community members. And I want to review the expansion of what's going on right now with telemedicine and telemental health specifically, and why counseling and support offered online are not only effective, but they're efficient, and you really need to engage in them right now if you're in need of treatment. And I'll provide a quick overview of kind of specifically what telemental health services are, what telemental health is. I'll give you a little bit of the history of the expansion of telemental health in the United States and why we're so lucky to have access to those services at this time. And lastly, I'm going to talk a little bit about virtual services. And we're going to talk about how you evaluate them, how we know if they're safe, effective. And I really want to make sure I get through the objective of how helpful they are when patients are in need, especially during a pandemic, to engage in treatment, and how safe they are, especially when we look at the outcomes compared to in-person services at this time. So I'm really excited to review these objectives. So what is going on right now? Why am I speaking to you today about emotional wellness? Well, this novel COVID-19 pandemic that kind of rocked our world in the United States at the end of February, early March 2020, has changed the way that the majority of us access any form of healthcare treatment at this time, and that really includes our psychiatric and behavioral health care. So as we can see here from this really terrifying looking New York Times front page, pressure on Trump as millions are kept home. So we know that at the beginning of the pandemic, many of us had to stay at home, and that became a huge problem. Early in the pandemic, we were all in kind of this acute crisis response. We needed to stay at home. I think for a lot of us, we hadn't been in a pandemic before. We hadn't been told we had to stay home, and there were curfews, and we had to wear masks, and we had to stay 6 to 12 feet away from people. I think there was an awful lot going on at that time. But overall, the real problem was, how has COVID-19 disrupted the delivery of mental health, substance use, and behavioral health treatment in this country? Because prior to the COVID-19 pandemic, we had a much longer epidemic going on, raging, if you will, in the United States of America. And it's called access to and treatment for those struggling with mental health and substance use disorders. We've had a huge crisis in this country that we're trying to work on, and the pandemic has really kind of thrown a wrench in our plans and how we engage and provide treatment for people. So we know that pre-pandemic, we already had people who were in a crisis with mental health and substance use disorders. And now, because of social distancing and stay-at-home orders that were in place, we haven't been able to get people the care that they need. And so that's what we'll be emphasizing and talking about today, is how important it is to get to treatment if you need it, to ask about treatment if you're considering it or contemplating it, and also how effective telemental healthcare is at this time. At the beginning of the pandemic in about March and April, we knew that there was a huge emphasis on keeping our healthcare workers safe. We wanted to keep our frontline workers safe. And so for a lot of patients, they forewent appointments. They avoided hospitals, they avoided doctors' offices and some of their annual appointments. And I think it can very well be said for today that a lot of people are continuing to do that. We're staying away from hospitals, we're staying away from urban environments like one where Mass General is located in the city. We want to make sure that we're keeping ourselves and our family and friends safe. But by doing that physical distancing, we may be putting a huge, huge burden on our emotional and our mental well-being. So we're going to talk a little bit about why that's such a big problem today. And one other thing I want to make sure that I outline is that when we were all being told not to go to school, not to go to work, that also meant that a lot of our community-based mental health facilities that were providing the bulk of our treatment and care to patients in this country and in Massachusetts, they were closed as well. And they had to pivot, just like the clinic that I work in, which is an outpatient clinic at Mass General Hospital, focusing on psychiatry and addiction. We had to stop for a minute and pivot. And how are we going to meet the needs of all of our patients? So then we had that going on. So that was a whole other problem. I think right now, when we look at the fact that we're still trying to get patients to adapt and be open to addressing their healthcare needs, it's still a problem. You know, this is a pandemic. This is a time where a lot of people have a lot of uncertainty and worry and fear, and mental health and emotional health may be at the bottom of the pyramid in terms of what they want to take care of on a daily basis. But hopefully I can address with you today how important it is that we get patients engaged, and it's not a problem anymore. And lastly, even before the pandemic started, we had this shortage of mental health professionals in the country, including Massachusetts, which you think of Massachusetts as having all this great access to care and really great health care, and we pride ourselves on that. We have got a shortage of mental health professionals, especially in some of our more rural areas. And so when we think about how that's being affected during the COVID-19 pandemic, we know that's just being exacerbated. So we'll talk a little bit about getting patients engaged today. So let's talk a little bit more about the need for mental health and behavioral health care at this time in Massachusetts, in the nation, internationally. So due to the COVID-19 pandemic, we know that a lot of people are struggling, and even more are struggling with mental health and behavioral health symptoms. We know that in the United States of America, on average, it takes a patient about 10 years to even engage in initial psychiatric or mental health treatment. We also know that suicide is the 10th leading cause of death in the United States, and about 1 in 4 adults, that's about 47 million people, and I'm sure it's even more now, have experienced within a given year a mental health symptom or a substance use disorder. We know that there is also a lot of co-occurring disorders as well that include patients struggling with mental health and co-occurring substance use disorders. And more than ever, that's being exacerbated. Those symptoms are being worsened in the light of fear, uncertainty, job loss within the COVID-19 pandemic. So more than ever, we're also social isolating. We have to stay home, we have to stay safe, we have to keep our family and friends safe, and we're doing that by social isolating. And we know that there's really nothing worse for depression and mental health care than socially isolating ourselves. So we're exacerbating our own mental health and behavioral health needs because of the social isolation protocols in place. A lot of us aren't going to work, we're not engaging and interacting with our colleagues, we're not going to the gym, walking the dog maybe looks a little different, maybe we move a little faster now, we wear a mask, we're a little less friendly, all because of the COVID-19 pandemic and the need to socially isolate. And this is affecting different groups as well. And 2 examples I want to give you is, for example, if you're a household during the pandemic in March, and you had 2 adults who were working, they were going off to work every day, they were leaving the home, maybe they had 4 children, that has added an incredible amount of pressure due to this COVID-19 pandemic. We have a totally different at-home condition for those households with children and adolescents because you now have a lot of them at home, or they were at home doing social distance learning. So the parents have not only had to pivot and come home and work from home, but now they're providing the educational services, and that's going to obviously sometimes increase worry, fear, and our mental and emotional wellness when we're at home with, 6 other people that we weren't maybe balancing our life with before. It's kind of changed our schedules. The other effect on the social isolation group that I want to point out is the one that's for older adults. We know that for the older adult population, social isolation and isolation is already a huge risk factor for them. We don't want them to be alone. That's why we have a lot of great programs for our older adult population. We want to engage them in as many programs as we can. We want to get them out of the house. We want to get them moving. And we want them to be both physically and mentally well so that they live long and happy lives. So now we have a pandemic that's telling us that older adults are really the most at-risk population. And on top of that, we're further social isolating that group of individuals of older adults so that their mental health and their behavioral health and emotional wellness has been greatly impacted due to the COVID-19 pandemic. We also need to take into consideration how there are so many people in this country right now who have increased mental health and behavioral health concerns and symptoms due to the economy at this time. We have more job loss and income insecurity than we've probably ever had, and it's in the midst of an external stressor known as the pandemic. So a lot of uncertainty for people, a lot of concern, a lot of worry, and we know that we need to get people back to work, but we also want to do it in a safe way, and that's really hard to do too when a lot of people are fearful of getting this very scary COVID-19. Also, I want to point out the fact that there's a lot of burnout and strain when we look at frontline workers. That's workers who work in hospitals, who work in schools, who have resumed in-person classes. Also for frontline workers who have been working at the gas stations, the pharmacies, and the grocery stores the entire time during this pandemic. There's an increased need for treatment and care because we know that there's going to be an increased level of anxiety, fear, worry, and depression, potentially mental health symptoms with that population. And so more than ever, we have got so many patients who are already suffering from mental health illnesses, symptoms, and co-occurring or sometimes standalone substance use disorders. And now we've really compounded it when you take a look at the need for treatment with patients with mental health disorders. As I mentioned before, we have such a need for treatment. The pandemic is increasing demand for mental health and substance use services, and that's because of fear, bereavement, loss of income, isolation, and we know that the alcohol and the drug use is increasing big time during this very scary time. So I wanted to give you guys some visuals on kind of how the public in America generally is feeling, how their anxiety, depression, worry is during this pandemic time, how the uncertainty and fear has maybe led to increased anxiety and depression. So the Kaiser Family Foundation has been doing kind of this smaller longitudinal study. And here I just can see May, June, and July. We're looking at those months and we can see that more adults are reporting symptoms of anxiety and depression as each month goes on. It would be very interesting to look at the current data and see what August through November has looked like. I think a lot of patients, the ones I work with especially, are reporting increased anxiety, increased uncertainty. Things are being exacerbated for them. And so it's really a great time right now to focus on the fact that people are sicker than ever. And it's not just the physical piece, it's also the emotional piece in this country. And how do we get the treatment to those who need it the most? And as you can see here, it's increasing. Anxiety symptoms, depression symptoms, they're increasing each month. And I have to imagine if we were to look at the data for November, it's increased as well. Going back to that really important population of older adults, ages 65 and up, when we take a look at that population, we know that they are struggling. They're socially isolated. They're fearful. There's a lot of uncertainty. Access to treatment may be uncertain at this time. They may be fearful to leave their home. And so the Kaiser Foundation asked them, has the coronavirus had a negative impact on their mental health? And as we can see, looking at the tracking from March through July, those numbers have increased. And I have to imagine if we were to look at and project what's occurring August through November, we'll see that some of those numbers have continued to increase, with increasing numbers of hospitalizations, deaths, and people testing positive for the coronavirus. And then one last chart I want to give you guys a visual of. Kaiser asked people, has the coronavirus had a negative impact on their mental health? And there's a significant portion of adults who are reporting yes. Whether it's a minor or a major impact on their life, there has been an impact. And we know that an impact over time could lead to chronic, both physical and emotional and mental health symptoms. So we want to make sure that we treat people and we get them engaged with care. And as we can see here from this visual, people are reporting that they're not doing well. And there's a lot of stigma in the United States when it comes to mental health and substance use disorders. So these are the reports. So you can only imagine that these are probably underreported numbers, as most people don't always feel very comfortable kind of raising their hand and saying, yeah, I've got depression, anxiety, trauma, acute trauma because of the pandemic. I'm worried, I'm scared, I'm fearful. So as you can see here, most people are reporting at least some impact, if not a major impact. And it doesn't matter gender, it doesn't matter ethnicity, it doesn't matter if you've got a child or not. We're feeling overwhelmed, we're feeling stress and worry that's directly related to the coronavirus. And so I want to talk about expansion of telemental health, and not just telemental health, but also telemedicine. So the expansion of telemental health, where treatment is offered online during this pandemic, is more important, excuse me, than ever. It is so important during this public health emergency that we not only get people who were already continually involved in treatment, we want them to continue that treatment for their mental health and psychiatric disorders and substance use treatment, but we also want to get those who have new symptoms occurring, who are feeling a new onset of anxiety, depression, and what have you. So we know that there's a need right now more than ever to get people engaged in treatment. And how do we do that in a safe way? We do that by having them engage in telemental health. We're very lucky at this time in the United States of America, and state by state, a lot of states have temporarily suspended some of their regulatory provisions. That also includes increasing health insurance coverage for patients so that they can access, when we think about Medicare and Medicaid, the ability for that group of patients to now access telemedicine and telemental services is huge. At the beginning of the pandemic in April, there was a report by primary care providers in the United States that they had seen a 60% decrease in their ambulatory or outpatient appointments. So we know that there were people who were once going to the hospital who just stopped going. And part of that's because of the pandemic and fear and worry, but also because of the social distancing. So when we take a look at that number of patients not going to treatment physically anymore, and we take a look at how many people in the United States have mental health symptoms, we know that there's a need, an increased need to get patients connected to mental health and substance use treatment. And how are we going to do that? We're going to do it through telemental health, and it's going to be effective. Telemental health also facilitates the public health mitigation, because what it does is it helps keep people at home. It helps keep people safe. All they have to do is walk up to their computer or their smartphone. They don't have to go anywhere. And so if you're an older adult population, or a population with a young child, or someone with kind of a chronic immune deficiency disorder, you have the ability of accessing your mental health services without either making other people in the community sick, like providers or patients, or yourself sick, which is really huge. And then lastly, telehealth and telemedicine is booming. It is expanding more than ever. Even before COVID-19, it is currently a $34 billion industry and growing. So probably a lot of you are wondering what this jargon of telemental health is that I'm referring to. You've probably heard of telepsychiatry, telemedicine, telehealth. Well, today we're talking a little bit about telemental health and what the role is it plays in maintaining emotional health during a global pandemic that's as scary as this one that we're living through at this current time. Telemental health is really, it is providing the same psychiatry services and psychological services that we were providing in person. It's now providing them through virtual gateways. So when we think about telepsychiatry, behavioral therapy, psychotherapy, medication management treatment for people who need prescriptions, those can all be provided through telemental health. And it can be provided through virtual video conferencing. Sometimes your clinicians will call that a virtual visit. We offer lots of those at Mass General Hospital at this time. It can also be done through something called like mobile health. Like we think about a lot of the apps that patients engage with, or secure encrypted texting that they have with their provider. It can also be done through the telephone too. You can have a provider call up and have an appointment processed over the phone if you don't have access to video conferencing software. It's important that I underline privacy and confidentiality regarding telemental health. And I want you all to remember that privacy and confidentiality rules still apply to telemental health. So they're HIPAA compliant, they're confidential, they're safe, they're effective, especially now during this pandemic. So telemental health services, what do they exist? I've given you a little bit of information as to what we can provide, but I want to break it down for those who maybe have not engaged in psychiatric treatment services, behavioral health, mental health services before. Maybe you've never seen a therapist, and that's okay. But I want to give you guys a little bit of psychoeducation as to what I mean when I say we can provide telemental health services virtually online for you, your loved ones, your family, what have you. So anything from psychiatric assessments, evaluation, diagnoses of certain illnesses or symptoms that are maybe new onset or even chronic, we can manage those. Most telemental health services are provided by staff psychologists, psychiatrists, nurse practitioners, clinical social workers, behavioral health care providers, really make up these comprehensive treatment teams that have the ability to provide psychiatric assessments and do evaluation and then make a diagnosis. We also know that medication management and psychopharmacology can be provided. If you're someone that was engaged in medication-assisted treatment, I think for some people we've heard of methadone or Suboxone before for helping those with substance use disorders, like an opioid use disorder. How did you access treatment now that the COVID pandemic has begun? Well, you're doing that through telemental health services, and they've become really advanced in how we can not only meet patients' needs where they're at, but provide really good education to them and their families about how it's going to look for the next couple months while they're engaging with us over virtual televideo conferencing software. We can also provide case consultation treatment, which can provide increased access to mental health treatment and understanding for providers like primary care providers, what would be best for treating their patients during this pandemic through a virtual visit. Another great thing that we can offer through telemental health services is all of the individual psychotherapy and group treatment that we offered before. At the clinic I'm working at now, we're really emphasizing how important it is to engage and remain engaged in treatment for people to maintain their good emotional and mental health in addition to their physical health during this pandemic. So anything from individual therapy, group psychotherapy, that can all be offered at this time virtually. And that includes couples and family therapy. We know that more than ever during this pandemic, families are struggling, couples sometimes are coming closer together, or they're being driven farther apart due to this pandemic. And that doesn't mean just because there is a pandemic on our hands, you shouldn't be engaging in treatment, or you should be avoiding it. So it's really important that I mention that. Additionally, what we have is continuity of care treatment, care coordination services. If you have a loved one or a family member who is struggling with a mental health illness or new onset of symptoms, behavioral health symptoms, substance use disorder is maybe worsening, I want you to be able to understand that social workers, behavioral health care advocates, as well as clinicians have not gone anywhere. We're still around. We can still provide effective services. I think you'd all be amazed at how great some of the technology is now for providing some of these telemental health services. And that includes care coordination. That includes getting patients to the treatment that they need. If outpatient level of care isn't appropriate, having a psychiatric assessment or evaluation with a provider can be incredibly worthwhile, because it can connect you to the treatment that you need. And so that means a referral to an inpatient setting due to a psychiatric crisis, or if there's a need for an increased level of treatment for a substance use disorder, we can still provide all of that care by connecting with providers. So don't ever fear about reaching out to get the treatment that you and your family deserve and need. And then last but not least, telemental health services provided by clinicians, medical doctors, nurse practitioners. We can still provide really great comprehensive patient and provider psychoeducation. Patients and their families sometimes are worried about their loved one and what's been going on. And when you look at the fact that people are sicker than ever, both physically, emotionally, and mental health wise, due to this pandemic, I think families and patients have a lot of concerns. They have a lot of worry, a lot of self-stigma. They're worried about the public stigma of engaging in mental health treatment. And we can provide a lot of answers. We can answer a lot of questions by having people engage in treatment with us. And that's something I want to make sure that you all understand is, just because you come into a telemental health appointment, maybe it's a first-time appointment, that doesn't necessarily mean that you've signed on for something for the rest of your life. You can certainly come for a consultation and make a decision with you and your family or your spouse as to what you want to do from there when it comes to your own mental and emotional health. And last but not least, not so much a clinical telemental health service, but I want to make sure I let people know some of the resources that are available during this time for those with mental health symptoms, emotional symptoms that are worsening, as well as substance use disorders. We've still got access, if not more than ever, access to Alcoholics Anonymous, Smart Recovery, Al-Anon, those virtual self-help meetings that people so rely on, like Narcotics Anonymous. It's really important that people still get to access that level of care and that treatment. And so those virtual self-help groups are still happening. Sometimes they're over the phone. Other times they occur over like a Zoom software, or there's a couple of other mobile softwares that have been used for telemental services when it comes to like self-help groups specifically. But all it takes sometimes is contacting a provider, your primary care doctor or a psychiatric provider or clinician, to ask about how to engage in those. And we can help with that too at Mass General. Or it can also include just doing a quick Google search of, where is an Alcoholics Anonymous or, Marijuana Anonymous meeting in my community that I can access. And you'd be amazed through Google how many really wonderful supports have been set up for the self-help community. And that also includes the virtual support group community, like Depression Bipolar Support Alliance, the Anxiety Depression Alliance of America. They're still running meetings. They're virtual. There's no need to not be engaged at this time due to the pandemic. And then also recovery coaching services, which is something we've expanded recently for the substance use treatment of patients at Mass General Hospital. Those services are all still being conducted virtually at this time. And this is really how telehealth delivery looks. I know that this is a little bit of a cryptic looking chart, but it still also has a connection to telemental health. And we look at kind of clinical and non-clinical provision of treatment that our providers at Mass General and beyond in the community can provide. And so there's various types of telehealth technology and telemental health technology. I think a lot of us are very familiar with the live video conferencing. That's majority of what your virtual visits are at a hospital or a community-based healthcare setting or with a therapist. That's something where you have the televideo conferencing software and you can see someone in live real time. There's also asynchronous, which could also be known as store and forward, which can sometimes be like your provider or a patient sending a message or recording a video and then sending it to a provider, or a provider sending it to a patient to ask a question or get like a medication management information. There's also the growing field of telemental health, mobile health, which we also know as like mHealth when we think of all of the new applications online right now that provide patients with really good access to anything from cognitive behavioral therapy to performing meditation, to finding out where you can connect with like a peer support specialist for your mental health needs. All of that is available through the new and kind of booming mobile health technology field of telehealth and telemental health. And then last but not least, there's the remote patient monitoring, which is RPM. That's a growing field as well. That can be both conducted synchronous and asynchronously. So it depends on kind of the telehealth that you're engaged in, who your provider is, and what they're looking to help you kind of monitor. And so advantages. What are the advantages to telemental health services? There are so many. I could have literally made a list of 100. I am very much an advocate for patients, family members, providers engaging in the provision of telehealth and, most importantly, telemental health at this time, not just because of the pandemic. Prior to the pandemic, we had a huge problem with mental health and substance use in this country, and we need to get patients access to the treatment that they need and they deserve. And this is far beyond and far long before this pandemic ever came in the United States of America. We have had patients in rural areas that have not had access to mental health treatment for a very long time. I'm very excited to read, information, some of the research that showed since March 1st, there has been a 1,300% increase in healthcare providers across the country providing some level of telehealth, telemedicine, or telemental care to patients. And that's great because that means that patients more than ever have access to treatment that they need and they deserve. And so there are tons of advantages to these virtual services. They're safe, they're effective, they've got similar outcomes than if you were to come in and meet with us in the clinic and come to a hospital or come to a community-based provider. Access to mental health care providers and medication management during this stressful, fear-driven pandemic time is more important than ever. And telemental health has the ability to not just provide good mental and behavioral health treatment at this time, but a broad range of mental health and psychological services that I just kind of reviewed a few minutes ago about how much we can provide. It's not just meeting with a psychiatrist virtually for 5 minutes over Zoom. It's so much more than that. It's really comprehensive treatment, and it's treatment across the continuum of higher levels of care and various levels of care for patients with mental health illnesses, symptoms, new onset symptoms, substance use disorders, etc. We know that by going to treatment, there's a lot of stigma and labels involved, but if you come to treatment and you do it virtually, that can sometimes help to significantly reduce the stigma that there is towards those engaging in mental health and substance use treatment. So I always want to make sure people understand how important it is that they engage in treatment. It doesn't matter how they do it, whether it's over the phone, whether it's virtually, whether it's in person, we want them to engage in treatment. And we know that by having telemental health, that significantly has an impact on the ability to reduce stigma of how we view people with mental health and substance use disorders in this country. It also increases convenience for patients. More than ever, instead of getting in your car and driving to a hospital or driving to a clinician or a provider, paying tolls, paying for parking, trying to find parking if you're in the Boston area, God help you, or trying to, find the appointment. A lot of my patients spend several hours coming to an appointment with me, and the appointment sometimes isn't even a whole hour. So the level of convenience that has been increased for patients has been huge through telemental health. They have the ability to not only go to more treatment, but they have a little bit more time in their day. And we know that when you have time and you can practice good emotional and mental health care, we know that we're going to be overall doing better in life, less pain, sleeping better, feeling better overall. So when patients can have convenience in their life, we want to push that. We also know that telemental health is an effective approach to making sure that patients and providers are safe. We have certain things set in place so that we can make sure during the treatment and the psychiatric evaluation that we're making sure patients are safe just because they're not physically with us in our appointment or office spaces. Also, privacy and confidentiality, it's huge that I continue to let you know that this is a confidential, and this is an efficient way of seeing psychiatric treatment providers during this pandemic. Also, there's a wide range of the telemedicine flexibilities. As I mentioned before, we can do everything from a mobile health app to get in touch with patients to doing some self-help monitoring, whether it's through remote patient monitoring. We can meet with patients through video conferencing, or we can call them on the phone. There's a wide range of how we can access patients and get them the treatment that they need at this time. And then case management services, I mentioned that before, how important it is that it's not just always treatment. Sometimes you want to ask providers questions. Sometimes you want to advocate for a family member that's maybe not doing well. And you can ask all of those questions with your treatment providers when you do telemental health or you engage in an appointment. Those case management services are still very much involved. And last but not least, one of the best advantages right now to engaging in telemental health services is the fact that you're limiting community spread of the COVID-19 virus by staying at home, by not getting in your car, by not bringing your home germs to the hospital, by not bringing the hospital germs home to your family. You are limiting the exposure to other patients and staff members and yourself to the COVID-19 pandemic. And that's probably one of the biggest advantages right now during this time. So I want to pivot a little bit and talk about emotional wellness. And I want to end this presentation today by really talking about the importance of balancing emotional wellness. I think a lot of people right now are focusing on physical health of their family and their children and their older adult parents and their loved ones. But I think there's less self-care being practiced right now at this time for us. I think there's also less emotional wellness. I may be guilty of this, as myself at times. We need to make sure that we have a balance. And as this little cartoon that I love shows, we need to make sure that we understand that pandemics can be stressful. And this COVID-19 pandemic, more than ever, is very, very stressful. There's a lot of fear and anxiety about this new disease. We're doing, I think, our best to try to cope with stress in a healthy way. But I think as we've seen numbers of substance use, drug use, and alcohol use just skyrocket since March, we know that people are also coping in unhealthy ways. And some people who may have been sober or abstinent from substances before have had a slip or a relapse due to just so much fear, uncertainty, unemployment, and financial insecurity in this country at this time. So it's important that we understand how important emotional wellness is. We really need to make sure that we practice a mindful outlook every day. And I think during a time of a pandemic when there is so much fear and worry, I think a lot of us are guilty of having pretty significant changes in sleep and eating patterns. We're having trouble concentrating right now. We've got chronic health problems that are potentially being exacerbated by this pandemic, as well as worsening mental health conditions. It's more important than ever to be aware of your emotional wellness and how you take care of yourself. And so how do we maintain emotional wellness at this time? Emotional wellness is really taking care of yourself and understanding your emotions, really having an awareness and acceptance of your feelings and being able to explore who you are and how can you enhance your inner self, your inner emotional wellness by taking a look around and seeing where you can reduce stress, where you can improve resiliency, and how you can have yourself feel better. How we feel really matters. And I think for a lot of people right now, social media certainly has an impact, but I think there are those who say, I'm getting through every day, my kids are going to school, I'm fine, I just need to get through this, I just need to put one foot in front of the other. And I think that does work for a period of time, but overall that's going to have a chronic effect on not only your emotional wellness, but your mental health. And we want to make sure that people are not just physically healthy during this pandemic, but they're emotionally and mentally healthy. We want people really as a whole to come out of this pandemic healthier than they went into it, by finding new lifestyles, trying new things. Meditation's a new thing that we've tried. But we know overall that we want people to be healthy, and that starts with having good emotional wellness. So here's some examples of emotional wellness that everyone can practice and think about. Is we need to figure out who we are and what our feelings are. How do we accept ourselves? Are we accepting ourselves for who we are? This may sound like a little bit like we're in a yoga class right now and it's existential, and that's actually not what I want to put across. I want to put across how important it is to have good emotional wellness and being able to be accepting of ourselves and being able to advocate for ourselves and explore who we are. And that means having good emotional wellness by accepting who we are every day and, valuing self-exploration and improvement. I think for a lot of us, we're getting outside more, we're spending more time with our animals and pets. I think we're developing resiliency because this is such a scary, fearful, worrisome time during this pandemic that we don't have a choice. For a lot of us, we have to kind of, put our, boots on, tie them up and get out there and pull ourselves up by our bootstraps and just be strong. And part of that is through emotional wellness, and other times it's just part of just stone cold concrete resiliency. But having a positive outlook can be huge. Taking care of yourself both physically and emotionally, making sure you eat well, making sure you work out on a daily basis, making sure that we recognize when our stress is increasing, our worry or fear is increasing, maybe having an awareness and self-monitoring of when our anxiety and depression symptoms are creeping up or they're worsening, or maybe a new onset of a psychiatric illness or symptoms. It's important that we're doing that self-monitoring as part of taking good care of ourselves. It's also important that we understand how necessary it is to ask for help. And I hope one of the things that everyone takes away from this presentation today is how important it is to ask for help and engage in help, even if you're not sure if you need it. Let someone know, communicate, talk to one of your social supports about how you may be struggling and how you need to ask for help, or advocating for others in your life that maybe need to ask for help. And then strengthening your connections. I think for a lot of us, our social supports have decreased big time. We're not seeing each other. We're more socially isolated, but we know more than ever we can use Zoom, we can use FaceTime, we can use different apps on our phone to connect with friends and loved ones. And it's really important that we do this at this time, not just for ourselves, but also for others, making sure we strengthen connections within our community. And looking for joy and satisfaction in our day-to-day lives. If it's as easy as buying yourself this great donut for breakfast someday because it's Monday and you're struggling, perfect. If other days it means taking a walk in nature without your phone, without any music, just kind of being present, great. For other people, finding joy and satisfaction is coming through meditation. And that's a really wonderful thing. There's a lot of new mobile health apps that incorporate meditation, and I encourage you all to take a look at it through your smartphones if you have access, to see where you could find maybe new levels of growth, and sometimes that includes meditation. Overall, I think it's really important to end today on the fact that good emotional health, good emotional wellness, and good mental health is fundamental, absolutely fundamental to good overall health and well-being. If we're not taking care of our emotional needs and we're not taking care of our mental health needs, it's going to be really hard to physically feel good every day, and even harder to get through this pandemic together as a community. So I just want to finish up quickly by sharing a few resources here. There's clearly like a bajillion resources right now. We're really lucky to be in the United States of America, and furthermore in the state of Massachusetts, where we have so many resources. But these are the ones that I like to highlight the most. The Emotional Wellness Toolkit from the National Institute of Health is great. The National Institute of Wellness has a wellness screener. Not everyone has a diagnosable psychiatric disorder or mental health illness at this time. It can be more broad than that, and sometimes doing some of these screeners or utilizing these toolkits can be a good way for us to self-monitor and kind of see where we're at and where our wellness is at. As you can see, there's a couple other resources here, some locally, some nationally, some located here at Mass General, as well as some national resources. Just because this COVID pandemic has come doesn't mean that suicide, youth suicide, depression, anxiety, trauma, substance use has decreased. It's if anything, more present and increasing and exacerbated than ever. And so I want to make sure that people understand that, especially in the context of domestic violence. We know that those numbers are increasing as well. So I want to encourage people to, jot down these numbers, take them with you, pass them along as you can. They're really great resources for you to have. And that's all I have to say for today. Thank you so much. Thank you so much for having me. It's been a pleasure.
Great. Thank you so much, Jennifer. So we are now in the questions and answers portion. So if you have any questions to ask Jennifer, feel free to drop your question in the chat box. We do have a few that came in. One moment. So Jennifer, it appears there are trade-offs here. The patients that would otherwise need to travel for in-person therapy now can more easily connect through telehealth, assuming they have access. Are you concerned the patient may not be sharing some key things about what they're going through due to lack of privacy while trying to participate in the televisit? Examples include substance use disorder, depression, feelings of isolation.
Thanks. That's a great question. You know, I mentioned a lot of the advantages to telemental health. There are certainly some downsides. You know, we can't see the patient, touch the patient, smell the patient. You know, they're not in our office. We can't see if, you know, their leg is rocking severely or if they've got really bad shakes under the table. There are certainly barriers to doing virtual visits, but as we're looking at each other here today, it's clear, it's visible. We're really lucky that we have the ability to kind of see so clearly. The technology is so good that we're really able to connect with patients. And I think more than other psychiatrists, nurse practitioners, psychopharmacological providers in the field, as well as clinicians, they're very well trained and have been trained for a long time. They go to school for a long time to have a really good understanding of psychiatric awareness, symptoms, evaluation, and diagnosis. And so it may be that sometimes patients aren't always forthcoming with like their primary care provider, or if they're doing an evaluation with a patient, they're not so forthcoming with their symptoms. But what I think can also be tough is that patients need to advocate for themselves. And as providers, we try to meet patients halfway. And if a patient is only going to reveal so much, we're going to do our best to continue working with them. But sometimes that means that the onset of treatment is delayed a little bit because patients are not feeling so comfortable. But, you know, just like at Mass General Hospital, we've got a lot of wonderful providers who work with a lot of patients. And they're great people, they're great providers, and they're really great in engaging people who maybe are a little unsure about engaging in treatment.
We have another question. How would a doctor be able to have a good assessment without being able to measure a patient's blood pressure on a telemedicine appointment?
A great question. So I work in the field of psychiatry. I am not in the field of medicine, but you know, that's a tough one. There are certain logistics that we can't do over telemedicine and telemental health. Like, for example, we can't do a toxicology screen in the field of addiction treatment when we're working virtually. Sometimes we have the opportunity for sending patients to a hospital, you know, to do a treatment or to get an injection, to do something that really can't be performed over telehealth. When it comes to doing blood pressure, that's tough. That's really tough. And I think you're finding now more than ever that we're trying to increase some of the number of patients who come into medical treatment to see like their primary care providers. We don't want people to not go to their appointments. You know, there's some appointments like cardiac, neurological appointments, seeing your primary care provider for an annual appointment. Those are important appointments to still keep. When it comes to not just worsening mental health in this country, we know we also have worsening cases of physical health. People are putting off their mammograms, which is going to put us at a heightened risk of having more people with sicker cancer diagnosis in this country. You know, people aren't getting the treatment or getting maybe diagnosed as early as they can. So I still want to make sure I understand that I underline how wonderful telemental health and telehealth and telemedicine are. But there are certainly very appropriate circumstances, like if you're getting chemotherapy, for example, you got to go into your doctor. And the great thing about a place like Mass General is we have people wearing masks. People are using the best forms of care while also practicing really good COVID-19, contact precautions at this time. So I want to make sure people know that hospitals are still very much safe, and I still want you to go. And if you need your blood pressure read, you can always stop by CVS, but if your primary care provider needs to do it, you got to go in and see them. And if you're concerned, always give the office a call and ask what their precautions that they're using are.
And then, what if a family member is worried about another family member who is refusing treatment?
That's a great question. And that's a question that's existed in psychiatry and mental health long before COVID-19 in 2020. How do we advocate for those in our family who are maybe contemplating treatment, or maybe family members who are not even contemplating treatment? How do you advocate for them? As I mentioned before, one of the best things that you can do for yourself And this is a really great time for us to take care of ourselves right now. You know, like we used to be on airplanes, we put that mask on our face. We've got to take care of ourselves before we take care of others. And how we take care of others is communicating on behalf. How do we advocate for those in our life? We've got to reach out, whether it's to a provider, whether it's to a friend, whether we write an email to someone like myself who's a clinician in the field. We need to make sure that we reach out to those to try to advocate for our family and friends. And sometimes doing like a telemental health visit with a psychiatrist maybe feels like a little too much for a patient. They may say, I don't need that, I'm not that sick, or I'm not having that much of a hard time. But sometimes it's as easy as going to a support meeting or reading some information online, asking your primary care for information, and then you can pass that information along to a loved one. It's hard though. It's hard when you have a family member struggling and they're maybe not ready or not interested in engaging in treatment.
So in follow-up to that, what if a person is not comfortable coming forward to a doctor? Do you have any anonymous hotlines that you can recommend someone to call in?
Absolutely. And I can make sure, and how could I'll figure out a way to pass that along to you guys. But yeah, there's some really great hotlines where people can call up, you know, talk about suicide, talk about their mental health, talk about their wellness. There's a lot of really great support groups online that are maybe less clinical, not run by, you know, psychological professionals and run more by peers. And sometimes peer reflection can be so important. You know, sometimes it's hard to have a provider telling you need to do all these things and this is what they think's going on and this is how they diagnose you. Sometimes it can feel far more effective and warm to talk with someone who's got that lived experience. And so there's a lot of great supports out there. There's a lot of great national hotlines for those struggling with mental health, you know, new onset of symptoms, or people struggling with chronic mental health or substance use disorders. There's a lot of connections out there. Some of them I had in my resources. Some of them you can just Google and reach out online. Sometimes it's as easy as talking with someone. You'd probably be amazed how many times patients of mine will say, you know, I spoke with my neighbor yesterday and, you know, he's been sober from alcohol use for 45 years. I had no idea. And we got into this great conversation and we talked about getting into treatment and what worked for him and what could be helpful. And sometimes it's just really helpful at times to communicate, talk with your social supports, lean in, advocate for yourself by reaching out to others.
Right. So let's give it a few seconds to see if anyone has any final questions. And for those who have joined us today, as mentioned, if you're interested in viewing today's recording, feel free to hop onto our website, the Blum Center website. It's massgeneral.org/Blum-Center. And hopefully later on this week, we'll have the recording posted. Feel free to also email us at pflc@partners.org if you have any questions, like for instance, the resources that Dr. Blewett had mentioned that she can provide for us. We can always forward that to you. So feel free to email us as well. Okay, so I think that is all. Dr. Blewett, do you have any final comments you'd like to share?
I think, you know, just to reiterate what I said before, you know, good mental health is fundamental right now. And it means getting into the treatment that you need to get into. If you have, you know, something going on, you need to advocate for yourself, for your family members. Good mental health is fundamental to good overall health. It's not just about our physical health care. Make sure you engage in treatment if you need help. And more so than ever, we've got a lot of ways to take advantage of good mental health treatment at this time.
I can see even in the chat box, we have a number of comments of how people are agreeing with you that social support is important and mental health is very important. Okay, so I think that is all for today. Hope everyone found today's session very helpful. Thank you so much, Dr. Blewett. Thank you for joining us today.
Thank
Have
you
a good
so much.
day.